Hi, we are Beth and Courtney from the Advanced Hospice team. Care received through hospice emphasizes the fact that despite having an illness that's considered life-limiting, there is great purpose in our patients' lives. Our approach in supporting those entrusted to our care is about quality of life and living.
Hospice supports patients along their journey, following the philosophy of symptom management and comfort measures when curative interventions are no longer an option. Patients under hospice still receive medical care through a clinical team that assesses not only physical needs, but psychosocial and spiritual needs as well. We focus on the whole person.
Regulated by Medicare, hospice is a program that offers many benefits to both patients and their caregivers. It is available to patients of all ages that meet the diagnosis criteria for which we're seeing our patients. In addition to the team of a nurse, aide, social worker, and chaplain, we also pay for medications directly related to the diagnosis for which we are seeing our patients. Those medications are delivered to their door from our contracted pharmacist with no copays or any payment of any kind.
For hospice to be initiated, a physician's order is required to evaluate the patient. And for every diagnosis, there is set criteria that needs to be reviewed to ensure that the patient is appropriate for admission. And it is Medicare that sets these guidelines. When the nurse performs the clinical assessment, the assessment goes beyond a physical assessment. The nurse evaluates quality of life and how we can improve upon their needs and wishes.
And quality of life can mean different things to different people, but it focuses holistically on all aspects of the patient. Many of these are obvious, such as the physical, the emotional, psychosocial, and spiritual. But other characteristics need to be considered as well. Things such as personal autonomy, the necessity of health care and how procedures can take a toll on a patient, and cognition.
Focusing on quality of life and living, we place durable and medical equipment in the homes to keep our patients as mobile as possible while maintaining their safety. And because our patients deserve dignified care, we provide soft goods supplies, things such as incontinent products, gloves, wipes, bathing supplies, and more. Labs and testing are typically not performed on hospice patients as we are monitoring symptoms versus performing tests. Certain conditions, which generally warrant blood draws and treatments, can be treated prophylactically at this stage for the comfort of the patient. In the same manner, therapies are not a part of the plan of care because those disciplines are typically focused on rehabilitation, which no longer applies. However, minimal therapy can be approved in certain scenarios for teaching.
Choosing hospice should be an informed decision. We cannot stress enough that choosing hospice does not mean that you're giving up on life. Hospice is about care, support, hope, inspiration, peace, and yes, even life. For more information on the many benefits of hospice care, please feel free to call the Advanced Hospice Information Line at 412-710-7300, or you can always find additional information on our website at www.advancedhospicepa.com.
Thank you.